inflammatory foot and ankle surgery. And this morning I want to show you a case where we corrected a man who had an overlapping second toe and plantar plate tear in the second metatarsophalangeal joint. And the purpose of this video is to show how X-rays don't always tell the story. With this particular case, we were able to get rid of his pain without completely perfectly correcting the second MPJ joint. A lot of times it's hard to kind of recognize the fact that X-rays don't tell the whole story. This is particularly true with minimally invasive surgery. For those of us trained traditionally, we have a mindset that the X-ray has to look perfect or that things have to be exactly in line. That's not always the case clinically. So this is just a case I want to show you where we're able to get a man back to work in 2 days who had an overlapping second toe. He does construction work and couldn't be out of work for any length of time. He runs his own business, had to keep going. So basically we did a surgery on him on Friday and we showed him how to tape the toe over, and he went back to work on Monday and full working in a boot and everything. So we had to keep this minimally invasive and have a really quick recovery, and that's what I want to show you today and show you how well this patient did, and he'll give you a testimony saying that he has no pain as well. So we're able to do this with instituting minimally invasive surgery. This would be very hard to achieve with any tendon transfers or traditional procedure because he would have been out of work for too long. So I wanted to show you this today. Okay, so here's our patient. This is how he presented. You can see where he has a overlapping second toe on top of his big toe. Having a lot of pain in his work boot. Like I said in the introduction, he's a construction, has his own construction crew and a contractor, so he has to stay at work. So he came in wanting to have this corrected. He'd been to other doctors, and so he just wanted this resolved and a way to get back into work and quickly. Couldn't take any time off work at all. So here's what we decided to do with him. If you look at his pre-op X-ray here, you can see he has significant drifting of the toe medially and some basically offset of the second metatarsophalangeal joint level there. So this can be done with tendon transfers and other types of issues to get this straight. What we decided to do with him, we performed a minimally invasive surgical correction. You can see in the X-ray here, this is 1 week post-op. Basically just performed a wedge osteotomy of the toe at the proximal phalanx to allow basically transposing the toe laterally, not trying to worry too much with the second MPJ joint. So as the toe went on to healing, you can see in this X-ray where there is still some medial drift of the second MPJ joint. However, his toe is clinically straight. As you can see from this photo here, this is actually 1 week post-op, and he's maintained this, and we'll show you in our follow-up video here where the toe has maintained its position, and he's happy. He's not having the pain with his toe, and even more importantly, the second MPJ is no longer painful for him, so he's able to go back to work. He didn't take any days off work whatsoever, and was able to we were able to put him right directly back into his shoe after the surgery and show him how to bandage this, which he did himself. And we're looking at him now 2 months later here on our video and our testimonial here. This is our patient as a 4-month follow-up. We treated him for some plantar plate tear and pain in the ball of the foot where the plantar plate actually exists. His toe was drifting over his big toe, so he was also having pain at the top of his toe. So the toe was just problematic for him. And one of the more common ways to treat this is a tendon transfer, which works very well, but requires bigger incisions. What we decided to do with him was just to keep this simple and do a wedge osteotomy, which we did minimally invasive through a small incision. It's hard to see now, but that's all we did, and get his toe in a more rectus position. What this does, it realigns the plantar musculature and allows the pain to go away in the ball of the foot. Now when you look at the X-ray doesn't show a complete straightening, but the toe maintains a more rectus position and the pain goes away. So now we're 4 months later, and he was having a lot of pain. So we just asked the patient, now with the toe, does the toe bother you very much now, or none at all. So the patient's saying the toe doesn't bother him at all, even though despite if you were to look at this from a clinical standpoint and measure the metatarsophalangeal joint angle, it's still an issue, but the toe has got a better position rectusly, in a rectus position, so now the tendons are balanced and the pain goes away.